Yeah, right. So I'll be basically talking about cancer, what causes it, and how can we detect it early as well as prevent it in over maybe next 45 minutes to an hour. Just stop me if you feel that the time is over, or give me a warning 5 minutes ago so that I can cover important things which are remaining at that point in time, right? So these are the
Yes, sir.
things that we are going to discuss today. First, what actually is cancer? Just like any building, you are sitting in a building, I am also sitting in a building, is made up of small bricks which are individual components of a building. Similarly, we have cells which make our body. And those cells have a very controlled way of growth as well as dying. But sometimes the body's immune system is not able to check that controlled way, and some abnormal cells, they bypass the system and become cancerous. And when they grow at an uncontrolled pace without any control of the body or the immune system, they become cancer cells. And when they grow in large numbers, they are growing at the cost of your normal cells, and which is what results ultimately in weight loss and nutrition going mainly to cancer cells, which is supposed to be for our body. But we should remember that all tumors are not cancers. Only few tumors which have the ability to spread from one place to the other is termed as cancer. So any tumor in the body should not fear or scare you because it may or may not be cancer. Now let me start with the contribution of lifestyle in our in day-to-day health. This is a data of I've wrongly written it as 1990 in the above the pie chart, but this is actually 1900 in US, where two-thirds of the deaths were because of infections. However, 100 years later in 2000, it reversed. Infection was a small part of mortality cause, and lifestyle diseases, including cancer, became the majority cause for death in US. And this is not the story of US only, it is across the world, including India, that we are seeing more and more lifestyle diseases coming into play and and as a cause of death. And cancer is one of the very important lifestyle diseases, I would say. In India, we see nearly 15-16 lakh new cancer cases every year, and which is the government data, which obviously is incomplete because we are not able to capture everything. So it is higher than this. The problem, I'm just giving you an example of breast cancer, that 50% of the breast cancer patients in India actually die of the disease. However, in US, it is actually less than 1 in 4 patients. So this is less than 25% mortality. And in India, it is 50% mortality for breast cancer. There are various reasons for it, and I'll come to that as I progress. Nearly 60% of cancers are lifestyle related, of which nearly half of these are because of one product, which is tobacco in various forms. Tobacco leads to more than 13 lakhs deaths a year. And it is not cancer only. There are other diseases also which are caused by tobacco. So we can imagine how much havoc tobacco is playing in our lives. And if I ask you to compare with COVID, how many deaths actually happened because of COVID, and you see the right hand corner, lower corner of the screen. Since COVID came in until 2024, around 5 lakh deaths have been reported officially. If you can inflate this figure maybe by 6 times, 10 times, that means 50 lakhs over those 5 years. Whereas here we are losing 13 lakh people to tobacco every year. So in 5 years, this becomes much more than what COVID has done to our country or in general to the world. So there was so much of chaos, so much of fear because of COVID. But unfortunately, people don't do the same for tobacco, which is actually claiming many more lives every year. The other problem that we face in our country is our patients are almost a decade younger as compared to Western country patients. So if I have to give you an example, say colorectal cancer, that is large intestine, if it peaks in around 60, 65 years of age in the US, our peak incidence happens 10 to 15 years earlier, which is more productive age group. So as a result, 70% of our cancer deaths happen in the age group of 30 to 69 years, which is the most productive age group. People are progressing in their careers, almost peaking in their careers at that time. And many a times they are the only bread earners of the family. So one can imagine the damage it is doing to our countrymen. And the tobacco deaths, if I have to compare with tsunami, most many of you would remember, which came in Southeast Asia and claimed so many lives. If it happens 10 times in a year, or you would recall very recent incidents of a jet crashing in Ahmedabad Air India flight. If 10 such flights crash every day, this is the number of tobacco deaths happening every day. Coming to the causes of cancer, I can broadly divide them into three things. On the right corner is environment and the habit, then hereditary component, which is passing on from one generation to the other, and there are certain infections which can also lead to cancer if they are present for a long time in the body. Most of the time, there is interplay of one or more factors which leads to cancer. I already spoke about tobacco, any form, whether it is smoking, chewing tobacco, now pan masala with or without tobacco. So pan masala may not have tobacco, but pan masala contains substances which can cause oral cancer. 90% of the oral cancers, almost 90% of the lung cancers are because of tobacco, and there are many other cancers. People have been thinking that vaping or electronic cigarettes or e-cigarettes are better and they don't cause cancer, but that's a wrong notion that people have. It may be slightly safer as compared to tobacco cigarettes, but it has cancer causing chemicals in it and it is not safe enough. Similarly, excess use of alcohol, regular use of alcohol, and sometimes you can combine tobacco and alcohol and it causes even more damage. Obesity and lack of exercise is increasing in our society as well, just like the US society. High fat and low fiber diet. So, all of us uh, in India, not all of us, but in India in general, we are now copying the West, copying the West for wrong reasons. We are taking bad things from them rather than adapting their good habits. And what is West doing? West is now moving away from these bad habits. They now indulge in regular exercises. They are less obese. Obviously, their diet is much more healthier, and they are following what our traditional diet used to be many, many years ago. And we are moving towards Western diet, which is very unfortunate. So this is just a figure to show you various organs which can be affected by cancers which are related to tobacco. Shahid, could you please request others to be muted so that it's easier?
Sure, sir. I would request everyone to please keep yourself on mute, please.
So these are the cancers which are caused by tobacco. This is just see this slide and then compare with the next one. This is all the diseases because of tobacco. So left of the screen are cancers, the list of cancers, and on the right of screen is are other chronic diseases which can happen. And you see the list of diseases, other diseases is actually longer than the cancer. And these include retardation of the baby which is there in the womb of the mother. It can cause sexual impotence, erectile dysfunction, diabetes, it can make you prone for pneumonia and tuberculosis. So there are so many things which we probably don't understand when we are young, because these are chronic diseases will come with a prolonged use of tobacco, and by the time people reach middle age, they will suffer from many of these diseases. Now there are tobacco varieties, different types, and I said right lower corner, see pan parag also I have circled. So without tobacco, pan parag also causes that. And then alcohol also has a whole lot of list for cancers, again from top to bottom. And if you combine alcohol and tobacco, which very often happens, it doesn't work like 1 plus 1 is 2, because they help each other in generating the cancer cells in the body. And the effect of one is augmented by the other. Coming to infections, HPV, many of you might have heard called as human papilloma virus. And we most of the time, cervical cancer comes to our mind when we talk of HPV, but it is not only cervical cancer which can be caused by HPV, but there are many more cancers like oral cancers, throat cancers, anal cancers, or genital area cancers. So it's typically associated with cervical cancer in women, but men also have HPV related cancers in various parts of the body with changing pattern of sexual activity as well as passage of HPV virus from uh, one partner to the other. Then hepatitis B and C are other infections which can cause liver cirrhosis. I talked about alcohol earlier. Alcohol causes cirrhosis, and then because of cirrhosis, cancer develops. The same mechanism happens with hepatitis B and C, which in long run can cause inflammation of liver, cirrhosis of liver, and then cancer of the liver. HIV, all of you know about it, human immunodeficiency virus or AIDS virus. What it does is it compromises your immunity, as the name suggests, of the virus. And then once the immunity is compromised, there are many cancers which can surface because they are not kept in check by our immune system. So these are common infections which can lead to formation of cancers. Now, other risk factors include pollution, which is air, water pollution, radiation, uh, chemical pollution, which unfortunately sometimes happen because of our practices also. Can you see the photograph at the right bottom? And I just want to share one instance, or in fact, couple of instances I'll share. One was when I visited Japan many years ago, and on my way from airport to the hotel, I saw lots of chimneys there, but no smoke. And I was curious. I just asked the person. I said, "Are these factories all closed today, or they're not working?" Well, all of them are working. So that was the level of uh, control of the pollutants there. They will treat them and they will make them non-toxic before they release it to the environment. The other example I would like to give, if maybe few of you know about carpet industry in India, the hub of carpet industry is in UP, place called Bhadoi. And I was there for an awareness session and I was horrified to know that there are borings, right? Borings done in the ground to take out water. And there were many borings for many years lying dry because the water level had gone down. So what these people started to do was, from carpet industry, there was a liquid effluent coming out. They did not treat it to make it non-toxic. They just did a reverse boring kind of thing, and they put those effluents into their existing borings, and everything went into the land, making the land very toxic, and whatever is grown there also becomes very toxic. And as a result, cancer incidence has risen in that area. Radiation is another thing. We have normal radiation around us, which is cosmic radiation, but there are many other ways of radiation coming in. Just to give you an example, when Hiroshima and Nagasaki were bombed in 1945 during World War II, they are still seeing the bad effects of radiation and higher incidence of cancer in subsequent generations. Same happened when there was a nuclear reactor in Russia which had a leak, Chernobyl reactor, and the generations after that have had this problem. The chemical pollution, some of you may remember the Bhopal gas tragedy. Many people for generations actually suffered from diseases, including cancer. Now, coming to genetic or the hereditary part of it, everybody thinks that once there is a cancer in family, everybody else is at very high risk, or the next generation is at a very high risk. It's not so, because hereditary determined cancers are only around 10% and not more than that. Yes, if there are multiple cancers, similar types of cancer in a family or related people, you are likely to have higher risk and also likely to have some hereditary abnormality. But that's a small percentage. Stress is something which is not new to any one of us, and most people today have one kind or the other, one kind of stress or the other. And more more stress is added because of the work demands, because uh, people are traveling for work, they're living alone away from their families, nuclear families are there, And instead of having actual friends, they are having more virtual friends on social media. And then they are so much engaged with social media that they also have a stress that if I have posted something, I should have so many likes. Every friend should like me. I should have more friends. When actually none of them are going to de-stress you when you need them. So there are some modifiable factors and some non-modifiable factors, out of which, if you see modifiable, this is the list, and that's non-modifiable factor. So the list of modifiable factors is actually larger. And couple of things that I probably did not talk right now. First four I have. So breast cancer is also increased in those ladies who have much later pregnancies, those who never get pregnant, or those who do not breastfeed the child for adequate length of time. These are small risk factors, but they obviously add to the existing risk factors. So it is recommended that we have timely pregnancy, we breastfeed the baby for a year at least. I know it's not practical sometimes for those who are working. And so what can be done is, in a way, we may not give all the feeds to the child, but express the milk, keep it at home, then go for work, express again, and maybe go back and feed at night. But feeding for a year is usually recommended. And there are multiple reasons why breastfeeding is good, not only for the mother, but also for the child. It the initial part, first 5 to 6 months or initial few weeks, there are immune components also secreted in the milk, and they help the child become strong immunity wise as well as grow better. I already mentioned breastfeeding saves the mother also, risk of breast cancer decreases. And then obviously there is an emotional connect that happens between the mother and child while a mother breastfeeds a child. There are again wrong notions and myths around it that if I breastfeed, I'll gain weight or my figure will not be the same or my breasts will sag, which is not true. Whether you breastfeed or you don't, it is it is individual to individual how your breasts react to pregnancy and later, and it's not always that you have a disfigurement. So you can have fitness, proper fitness can be maintained while breastfeeding the child, and don't worry about all those things. So certain common cancers that we see in males and females in India, I have highlighted three of them because they are more common, they are easily detectable, they are curable if detected on time, highly curable, and all three of them are also preventable to some extent, especially oral cancer and cervical cancer. They can be prevented to a large extent. How do we stage cancer? There are two things which will come, and those of you who have seen cancers in their surroundings, family or friends, and seen the reports would know that the first question that comes to your mind is what is the stage of cancer? And then there is something called grade which is written in the reports. So are these two different? Yes. Stage tells you to what extent the cancer has spread or grown, and the grade tells us how aggressive the cancer is. So early stage cancer can also be high grade or more aggressive, and a stage 2, stage 3, stage 4 cancer can also be of low grade. So these are two different things, and we must understand that. So just to give you an example of staging by breast cancer, there is a small lump in the breast less than 2 centimeters, usually is stage 1. Then stage 2, when that lump grows a little bit, or it has spread slightly to your armpits on the sides, as you see the blue kidney bean shape lymph node there. Stage 3 would be when the breast lump increases in size, it has started to involve the skin or pull the skin very close to the skin, and the lymph node has increased, or lymph node has gone even to the neck area, lower neck area. Then it becomes stage 3. And stage 4 would mean cancer has spread to other organs apart from the organ of origin. So this is how staging happens in most of the cancers. How can we prevent and detect early? Very easy way of detection of some of the cancers could be self-examination. So you examine yourself, which is have a look at it and feel it, which is free. Then examination by a trained personnel who usually happens to be a doctor in India. And then certain investigations are recommended, tests are recommended for some cancers. Coming first to symptoms, because to detect early, you should know what are the symptoms. And let me at the outset tell you, all these symptoms that I'm going to tell you do not necessarily mean that you have cancer. They just mean that there is something wrong in the body and it could also be cancer. Many a times they are actually non-cancerous. So for example, lump anywhere in the body, especially the painless lumps, those which have newly appeared and are growing, or there was a lump earlier, but which has started to grow faster as compared to what it was earlier. So just to give you an example, if a lady comes to us with breast lump, out of 10 such ladies, 7 or 8 of them will actually not have cancer. They have something abnormal, but not cancer. So please don't go with the notion that any lump in your body is cancer. But do not ignore. Get it tested. Get it confirmed to be non-cancerous and then keep a watch on it without fearing about it. Similarly, any abnormal bleeding, which could either be in your vomit, in your coughing, in your stool, urine, after sexual activity, or after attaining menopause. So after menopause, we normally don't expect bleeding to happen, but if it happens, happens regularly, continues, it should be checked. So again, any of these symptoms that I'm mentioning now or have mentioned earlier, if they continue for over 2 to 3 weeks, you have to go to next step of checking. You may consult a doctor who would say, okay, for example, blood in stool. This is piles. ये piles हो गया है, bawasir. Yes, the most common cause is piles, but if it doesn't go away or it goes away and comes back, please do not take it as piles and get the next level of investigation done. Similarly, if we are passing, say, we pass stool once in a day or twice in a day normally, but it has changed. Constipation has appeared, sometimes diarrhea, sometimes constipation. I feel like passing stool again after I have passed. And similar things with urine. That means there is something wrong happening inside the intestine or the urinary bladder. And this is resulting in abnormal habits of passing urine and stool, which could just be infection, which could be growth in the prostate gland, or which could be a cancer developing somewhere here in the intestine or in the bladder. Non-healing ulcer. So that's a very common symptom of cancer in the mouth or even cancer in the skin. Many of us have experienced ulcers in the mouth, which are very painful, but they go away within 4 5 days, week, 10 days maximum. But these are non-healing ulcers. Despite treatment, they don't heal completely. They may decrease a bit because the infectious component will go with the treatment, but the cancerous component will not. Similarly, chronic cough, change in voice, all of us experience change in voice when our throats are not good and sore throat is there. But all that corrects itself within a few days, maximum few weeks. Changing mole. So mole are तिल कहते हैं, right, हिंदी में. So कोई mole है, मस्सा है. If it has been there, but it has now changed its character, like it has increased in size, it has become darker in color, the margins which were smooth are irregular, or it has started to bleed. This is a sign of mole converting into cancer. There's difficulty in swallowing, so you can feel that the food is getting stuck either in the throat or somewhere in the chest along the food pipe, and it goes to the stomach then. So initially it starts with that you have had some difficulty in having solid food, then you took a glass of water along with the food and it went down, and then it comes to semi-solid and then liquid. So progressively increasing difficulty in swallowing is a very strong symptom for cancer. I will be explaining now few of the cancers which are more common about a little greater detail about them. So any lump or change in size or shape of the breast. Normally, if you see, both the breasts may not be equal, but that's your normal finding from the beginning. But if there is a significant change in size or shape of the breast, the nipple gets deviated on one side, gets retracted inside. There is a nipple discharge or destruction. Now, nipple discharge could be of various types. Uh, the one which is more sinister is a clear kind of discharge. It's not bloody discharge. Bloody discharge also could be cancerous, but it is mostly because of a benign tumor. A discharge which is milky, which is non-bloody, which is, say, dirty kind of discharge, is usually not because of cancer. And the right way of knowing the color of the discharge is to take it on a piece of tissue or a napkin, white colored, and then you will see the right color. Otherwise, patients come to us, doctor, मेरा blood निकल रहा है. I am having bloody discharge. And when we see on the tissue, it actually is lightly greenish or muddy color and not actually bloody. Similarly, skin dimpling or thickening, or there is a lump in the armpit or lower neck. And I'll show you some pictures of the patients also, which will give you an idea. And you can also go on YouTube, see how to look for cancer symptoms and also to do self-examination. Now, if you see this picture, this lady breasts look apparently normal. But when she raises her hand up, you see that the left breast, which is right of the screen, is showing that there is some elevation of the skin happening. And if you have a closer look on that side, there is a dimpling of the skin happening because there is an underlying cancer which is pulling the skin inside, which you may not notice if you don't raise your hand while self-examining. Similarly, this nipple has gone inverted inside, which is again a very strong sign of cancer if it has happened recently. Some ladies may have it from the beginning, both sides or one side. That's not cancer, but it needs to be watched. Similarly, here you see a nipple which is deviated to one side and the other is nipple retracted, inverted that I had shown earlier. So deviation of nipple as well as retraction. So there is a difference between retraction and inversion. On the screen right side is inversion, which has gone inside. And on the screen left side, you see deviated nipple as well as retracted. It is pulled inside. It has not gone inside, but it is getting pulled inside. Similarly, this nipple also is getting pulled inside and there is some partial destruction of the nipple also seen here. Self-examination should be done by everybody who is 20 years and older. Should be done once in a month. The right time to do is 1 week after your periods begin. So if periods begin today, around 7 to 10 days later, I'm not going into detail how to do it. YouTube has very good videos and you can see that. Start doing it once in a month if you are 20 and above. So I'm not going into these details because we don't have that much time. Then clinical breast examination or examination by a doctor. It again starts at 20, but it is once in a year or once in 2 years, 3 years, depending on what we find in the initial examination years. After 40, it should be done yearly. If you are at higher risk for some reason, then this may be needed more often. And then thirdly, mammogram. Mammograms are recommended to be done as a screening after 40 years of age. And let us differentiate what is screening from doing investigation for a suspected cancer. Screening means you don't have a symptom, you don't have anything in the breast, but you go for this test. And then sometimes you can find cancers. For example, in this lady, you can see the arrow is pointing towards something which is not present on the left side mammogram, but is seen on the right side, which was a very small cancer. We could not have detected it unless we did a mammogram. Nobody can feel this, neither the patient herself or we can, or the doctor. Similarly, another mammogram, slightly larger cancer, not very well felt by the patient. Doctors may be able to feel it, but not always. Oral or throat cancers. Again, I will show you the pictures and then that makes it easier. These are some pictures of precancerous changes. So white patches, red patches inside without any growth or ulcer. However, the next slide you will see actual fully developed cancers. So most striking is the one right lower screen. You can see there is a growth, there is ulceration, and very common complaint is, doctor, my tooth were loose. I got them extracted, and then few weeks later or a month later, I noticed this growth coming in. Actually, what had happened was there was a small growth already there. They just got a tooth extraction done, did not notice that growth, which kept on increasing. And the person extracting the tooth also probably did not notice it. Now, for breast cancer screening, it has to be done periodically after 20 years. I've mentioned mammogram every 1 to 2 years from 40 to 50 years. Why this range of 40 to 50? Because different guidelines of different countries say 40, 45, 50. In India, I recommend 40 because, as I said in the beginning of my talk, that our patients are a decade younger as compared to Western patients. And for high risk women, we need more frequent screening, and sometimes we add MRI also to the screening of mammogram, but that's not a routine for general population. Gynecologic cancers, cervical is mainly because of HPV infection, poor hygiene, and is seen in poor socioeconomic strata or those who have multiple sexual partners and have unsafe sexual practices who don't use barrier. And uterine cancer, which is also part of uterus. Cervix is the lowermost part of uterus, and endometrial cancer happens in the upper part of the uterus, is more associated with affluent society because of obesity, high BP, and diabetes, all these things. So these are two different types of cancers in two different strata of the society that we see more often. So when I was training in a public hospital, Tata Memorial in Mumbai, we used to see more cervical cancers because more of rural population and lower socioeconomic strata came to that hospital. In a private corporate setup, we see more uterine cancers because more affluent people come to us. Cervical cancer screening should begin 3 years after the onset of sexual activity, should not be any later than 21 years of age. And more important is preventive care and counseling for our adolescent children. They should be told about safe sexual practices in school and also by parents because cervical cancer, if detected very early, means 100% cure. There is a there is a stage zero. I told you about stage 1 to 4, but there is a stage zero also of cervical cancer. There is a stage zero also in breast cancer. And if they can be detected, they are almost always curable. And there is a way to prevent cervical cancer also by giving HPV vaccine. Ideally should be given to young girls less than 14 years of age when you use only 2 dosage. After 14 years, you need 3 dosage. In some countries, HPV is also given to boys. It is not yet part of our immunization program in India. But if somebody wants to give it, it can be given because I mentioned in the beginning that HPV related cancers are cancers apart from cervical cancer, which can affect males as well. Coming to the last cancer that I will probably speak about individually is colorectal cancer. And the symptoms I did mention in the beginning that there's bleeding, constipation, all those things can happen. And here again, screening is recommended beyond 50 years of age. Very simple stool test can be done. And sometimes we do recommend colonoscopy the first time at 50 years. If everything is fine, then 5 years later, again, it should be done. It's basically a type of endoscopy where a flexible scope is inserted through the rectum inside and it will see the whole of large intestine. Some people call these cancers as silent killers because they produce very vague symptoms or they produce late symptoms, what we call. But what I say is they are ignored symptoms. Most of us will have at one point in time acidity, gas, bloating, and we just ignore it. We will maybe pop up some pills, Pandy or something else, antacids, and then it becomes better. We are fine. Few weeks later, again, we have some symptoms, or we have milder symptoms, but we continue our work without giving time to our health. And that is what happens with these cancers, which produce very vague symptoms, which go on for long length of time, and by the time you get investigated, they have already spread to other areas and have become stage 3, sometimes even stage 4. Now, coming to last part is cancer prevention. Lifestyle modification is what is in our hands, and I put it as 5 pillars of health: our food, our movement or exercise, our sleep, relaxation, and sleep and relaxation are slightly different from each other, and our habits. So, food. What do we eat? When do we eat? How do we eat? Very important. And let me tell you very simple things. Now, food is available from across the world and round the year, 12 months of the year. Yes, you can taste that sometimes to satisfy your tongue and palate, but largely it should be seasonal food, locally available food, and properly home cooked food. All three are very important: seasonal, locally available, and properly home cooked. Properly home cooked means, you can cook it, you can fry it and all that, but cooking should be minimized. As far as possible, have raw vegetables, some fruits, not excess of fruits. Instead of fruit juices, prefer having full fruits because juices actually consume too many fruits. So one glass of orange milk will have three oranges probably. When you eat only one, which gives you fiber, which gives you nutrients, and they don't give you excess sugar. But fruit juices will give you a lot of sugars, which is not right. It's best to eat as early as possible in the evening. And if some of you are Jains from Jain community, you would know not to eat before sunrise and not to eat after sunrise. So eating window is between the sunrise and sunset. And that gives you a chance to have intermittent fasting period of 12 to 14 hours, depending on which which time of the what time of the year it is. So eat early, don't eat and don't snack. Have two or three major meals, not beyond that. These are very important aspects of what to eat, how to eat, and when to eat. Then movement and exercise, I don't have to overemphasize on it. It is obviously needed, and more so because of today's sedentary lifestyle. Earlier, we were walking around, we were doing exercises, people were doing physical labor. Nowadays, even for switching on the fan, you don't have to get out of bed. You have automated homes. You don't have to even open your curtains. You have the remote in your hand. TV remotes actually came long time back. So we must move as much as possible and do exercise, regular exercises. Sleep again is very underrated component of our health, and it is very important. It is said sleep like a baby, और हिंदी में कहते हैं घोड़ा बेच के सो जाओ. Why it is important? Because sleep is the time when your body and mind are recovering from the day's grind. So you need not only adequate length of sleep, but also good quality of sleep. And that is the time when your body is recuperating, recovering for the next day. It is also important to keep your sleeping hours nearly constant. So a window cannot be that you sleep one day at 9 p.m. and the other day at 12 midnight or 2 a.m. and then get up accordingly. So that window has to be as tight as possible. Adequate sleep and good quality sleep is very important. Again, uh, early to bed and early to rise is a very, very old saying, and we have to remember that. As early to bed as possible and as early out of bed as possible, if possible before sunrise. Uh, may not be possible in many of our work routines, but you see, all Western countries, if you know, and those of you who might have worked for international companies know very well that they take care of their quality of life very, very well. However, we don't, unfortunately. Another point, to have a good sleep, stay away from screen at least 2 hours before you go to sleep. That's not the time to look at screens. Many of you might be working. You can say this is just not practical. But believe me, if you plan it well, it can be practical for most of us and most of the days. So, no screen before sleeping. If you get up at night, please do not see your phone. Keep it away. I am a healthcare practitioner. I need to keep my phone close to myself, and still I keep it around 2 feet away from me so that I can reach it when it rings. Most of you actually can switch it off and keep it away. Please do that, and avoid temptation of opening your social media at night because it will just prolong your awake time at night and will disturb the sleep. Now, relaxation by any hobby that you may have, could be music, could be something else, meditation, yoga. These are all activities which bring a lot of peace to our mind, and as a result, it heals our body. And I strongly believe that there is a strong body and mind connect. Mind controls your body, and for chronic diseases, including cancer, there is a big role for our mind to play, for our holistic health to play. And it's not only physical health. We have ample examples of physically fit people just dropping dead in the gymnasiums. They go to gyms for exercise and they just drop dead. Colleagues and friends and family are shocked. He was such a fit man or a woman. But this is how it happens because they may be physically fit, but not mentally, spiritually, emotionally, and socially. So these are the various aspects of your health: physical health, mental health, emotional health, spiritual health, social health. And finally, habits. I have already said a lot about it, so I don't need to say anymore. Let me just tell you one thing. Alcohol has some beneficial uses, industrial uses, medicinal uses, but tobacco has none. I haven't found any beneficial use of tobacco so far. And I've already told you in the beginning, nearly 30% of the cancers will be wiped out if this substance named tobacco is wiped out from the face of the earth. And just to give you an example, if somebody quits smoking, within 20 minutes, the blood pressure, which was elevated because of smoking, will return to normal. Within 3 days, their ability to breathe will become better. In a year after quitting, the risk of heart attack is reduced to half. And there was a study done in New York when public smoking was banned. In the next year, they saw that the hospital admissions by acute heart attack episodes actually had reduced by half. After 10 years of quitting tobacco, your lung cancer risk is equal to normal population. You remember I told you in the beginning, almost 90% of the cancers, lung cancers, are because of smoking. In India, it may be different because some of them now happen because of pollution. However, if somebody doesn't smoke for 10 years, the risk of lung cancer is reduced to normal population risk. Similarly, there are many other benefits which happen. Unfortunately, the damage that it has already caused to your lungs will not get reversed. And the lung capacity, which has already decreased, will not or may not improve significantly after you quit smoking. That's what is happening in our country. Over 5,000 children start tobacco every day, and only 3 to 5% of these will quit it for life if they do not have medical support. With medical support, maybe 15-20% will quit for life. So it's best not to initiate tobacco or smoking or any form of tobacco because you cannot quit it completely. Largely 80% of them will not be able to quit it completely. And if you don't cure your smoking, cancer or any such diseases may cure it because it will take your life away. So obviously smoking cannot happen. These are some activities that I have been involved in for tobacco control and just wanted to show you. Nothing, no details there. How do we treat cancer? People think there are three main pillars of surgery, radiation, and chemo. But there are many more added now: hormone therapy, targeted therapy, immunotherapy, and many other specialties are involved in overall cancer care. So pathologists are there, radiologists are there. They may come from different specialties, but they work together in a tumor board form. So we have a tumor board where we sit and discuss patient planning or treatment planning for all our patients once in a week, and which is what should happen in a good center which is providing cancer care. There are many advances in cancer treatment. I will just skip this slide, maybe leave it for question answer session if you have any. Uh, okay, so that's one of my most favorite slides. All of us have some bad habit which we want to leave. Say, for example, my favorite again is tobacco. So you smoke and somebody says, I won't quit. Then says, no, I want to, but I can't quit it. Or how do I do it? I don't know how to do it. And then ultimately they get help, they want to try, and finally they are able to do it. It's a long journey, but it's not impossible. So for whatever habit you think you have, which you want to change, you will have to work hard. You have to have a very strong resolve. You have to inform people around you that I want to do it and I need your help. So a friend of yours who says, "Oh, अरे यार, एक cigarette ले ले, कोई फर्क नहीं पड़ता," is not your friend. if you have told that person that I want to quit. Stay away from that person. So improve your lifestyle, promote holistic health, have regular checkups and screening, consult a specialist if you have a doubt. So somebody comes to me for heart problems, obviously I'm not the right person to consult them or advise them. I may give a basic advice, but I would ask them to see a physician or a cardiologist. Similarly, you must consult a specialist, but don't fear if you have it or one of your friends or family has it, because most of the time, if it is caught on time, you will sail through it. Yes, there are some times when we are not able to cure it, but still we are able to prolong life, not only quantity, but a good quality of life. Thank you.